Well, hi everyone, and welcome to this special one-off recording. And I'm just delighted to be joined by Jennie Pollock, who's the Associate Head of Public Policy at the Christian Medical Fellowship. Jennie, welcome.
Thank you very much. It's great to be here.
Now, I wondered if you could just start by introducing yourself and a little bit about your background, where you've come from, and what you're doing in your current role.
Sure. For the sake of time, my background is very varied, but for many years I felt like God was leading me towards being able to speak into issues of bioethics and medical ethics, particularly around beginning and end of life. And by a very long, twisty-turny circuitous route, here I am. So I joined CMF in October 2019. Before that, I'd done various admin jobs, but also studied a master's degree in philosophy. So that was some of the sort of underpinning background of why I'm here and what I do.
Fantastic. Just for those who are watching or listening who perhaps don't know what the CMF, the Christian Medical Fellowship, do, could you just give us a quick summary of what that ministry is?
Sure. Our little strapline is, we unite and equip Christian doctors, nurses and midwives to live and speak for Jesus. So we're a membership organisation. We've got over 6,000 members, doctors, nurses, midwives, students, and we're there to support them, resource them, encourage them in their workplace, particularly in ways where their work and their faith interact.
Fantastic. Like all of us, I've no doubt that the last 10 months, CMF's work during this pandemic has changed, grown, had to adapt. What has that been like for you and for your colleagues?
Yeah, particularly in the first few months, like everyone, just everything stopped. We had to drop everything and respond. And so we were able to do a lot of supporting of our members, particularly, and other medical professionals. We, for a couple of months, 3 months, I think it was, every night at 7 o'clock, we put out a live stream where we did a biblical reflection, encouragement, and then prayed for those on the front lines. And it was really great. We had lots of stories of people gathering around the nurses' station at 7 o'clock every evening just to listen and to pause and to pray together. So that was something that we put a lot of energy and effort into. Just coming alongside our members, supporting them. We really saw God's hand in it as well, that for several months before the virus struck, we'd been working on a pastoral care and wellbeing program, just wanting to kind of formalize that side of our work a bit more. And so when COVID hit, we had all these people prepared and ready. We'd done all the thinking. We'd got the email address set up and everything. So we just really saw God's provision that that was up and running and ready for people that needed it. So if anyone's listening who does need it, wellbeing@cmf.org.uk, wellbeing@cmf.org.uk. It's the email to contact. There's people there ready and willing to help if you need it.
Fantastic. Amazing, isn't it? You know, you hear so many stories of how God provides and how organizations had made changes even in the months before the pandemic that meant when it happened they were suddenly better equipped to step out. It's just phenomenal.
Almost like God knew
in one
what was
sense,
coming.
you kind of think, why are we surprised? And then yeah, but I am, and still praise God for it. Jennie, I want to talk about COVID-19 and healthcare professionals. Perhaps some people watching and listening have seen some of the media coverage, special reports from big hospitals around the country. And we all know that at the moment in particular, perhaps even more so than back in April in the first peak, that healthcare professionals are under intense pressure. I wonder if you could just tell us what life has been like for health professionals dealing with the pandemic every day in their work.
yeah, exhausting, scary, demoralizing, traumatic. I remember saying in one of our meetings early on in the pandemic that we were likely to see lots of people suffering PTSD when this was all over. And indeed, we've definitely heard about that. We're seeing that already. Just the daily buildup of stress. And particularly, I think the adrenaline carried us so far. There's that sense of let's all pull together, we can beat this. But now this second wave, and everyone's already exhausted, and the public opinion is so much more negative. They're feeling a lot of abuse and just demoralization from people going, oh, it's not real, you guys are just making it up, it's all some big conspiracy, you're just pretending to be exhausted and overrun for whatever reason those conspiracy theorists think that might be. So yeah, it's particularly exhausting now.
You mentioned trauma there and the fact that healthcare professionals are feeling traumatized. And I just wonder why is this pandemic being particularly bad for those involved in intensive care?
Yeah. I was listening to one of our members, Dr. James Haslam, was interviewed on the radio about this recently. And one of the points he made was that normally after a really stressful shift or week or season, you can go down to the pub with your friends and sit down and just laugh it off, chat, change the scene, change the tone. You can go to the cinema, or you can go away to the countryside for a weekend with your family or with some friends. And that's just not possible at the moment. So those normal places of letting off steam, letting off pressure, just aren't available to us. And of course, a lot of the time, doctors and nurses are having to break really bad news to relatives over the phone. I follow an Instagram account called Humans of COVID-19, and there's lots of medical professionals on there just sharing their stories. And so many of them are saying, I had to go out and stand in the car park and call this family, and I could hear them sobbing on the end of the line. And to just not be able to be there and offer that compassion, you'd normally sit down with them in a private room and give them a cup of tea and give them time. And to just have to do that over the phone, it is emotionally extremely draining. And sitting by the bedside, holding up an iPad so that somebody's loved ones can say goodbye for the last time, and listening in on all of those really difficult conversations, day after day after day, sometimes multiple times a day. There are lots of reasons why it's more stressful than usual.
I kind of feel like, just listening to you now, that think about my own pandemic experience, how sheltered I have been from any of this. And I guess people listening and watching, they may have had relatives who were in hospital, but even then, there's such a diversity of experience, even if you get into hospital, right? Like, it's not like every patient that goes into a COVID ward ends up in intensive care. But just those heartbreaking images of as you said, nurses holding iPads and married couples not able to properly say goodbye to each other. And it's so dehuman, isn't it? It's so the opposite of God's vision for what human life should be like, right?
Yeah, very much so. Yeah.
Obviously, Christians have been at the front line of this. Doctors, nurses, paramedics, ambulance drivers. I wonder if you could just speak into what some of the particular challenges have been for Christian medical professionals over the last 10, 12 months.
I think partly, again, as I was saying before, not being able to go down to the pub with your friends, you can't also go to your small group and talk about things, or go to church in the same way, and just be able to share with people, to get a hug when you need it. We're obviously all feeling that, whether you're a Christian or not, just not having all those spaces to go to. And I think particularly for Christians, there is also the pressure, as they always feel, to be a good witness to their colleagues as well. And so in this time, like I said, at the beginning of the pandemic, we were putting out prayer videos that people were able to gather around. So people kind of took a stand then and put a line in the sand saying, I've got something else to look to, someone else who gives me strength to go on. And now, 10 months later, they're still having to live that and draw on that strength because it's a witness to those around them as well. And just that added pressure of, if I have a bad day, other people are watching and judging whether my faith is really real because of that, and wanting to be a good witness, wanting to be able to hold out that hope to colleagues, to patients who are really struggling, just finding ways to do that ethically. There's a lot of mental and emotional stress and strain there as well.
One of the big impacts of COVID-19 has been on people's mental health, and medical professionals perhaps more than anyone else. I read something recently of, you've touched on this already, just that sheer exhaustion and having to go through it all over again. And as you said, this time without the public support, without the clap for carers really taking off as it did the first time. How have CMF been helping health professionals during this time, and then related, I guess, in particular when it comes to mental health?
Yeah, we, again, that wellbeing@cmf.org.uk email address is really key. We're there, we've got people ready, just who kind of understand. Some of them are also working on the front line still. Most of them are at least former medics. They've got some experience of it. They've got some understanding. And they've got the skills to be able to listen, to talk, to pray with people. So we've really been wanting to do that. We also have our members, we have what we call catalyst teams. So around the country, just groups of our members that meet together, that normally would meet together in person. Most of them have WhatsApp groups, and they're able to just connect together and support each other. So we support the team leaders, very biblical model, we support the 12 and those 12 support their 12 or whatever. So there are groups of others who are in the same place as you, in the same situation, going through the same things, that are just being a support. We're looking at having a prayer day coming up that we can just be praying for people. And in terms of just other ways that we would encourage health professionals to look after their mental health, is exactly all the things that and you would be telling us at this time. Go out for a walk, just get some fresh air, have a change of pace, change of scenery as much as you can, talk to somebody, get somebody to pray with you. If there's nobody at your church, come to CMF. We're really keen to help with that.
Many of our care supporters, people watching, listening to this, will be asking themselves, how can I pray for doctors and nurses, CMF members and so on? So maybe just to finish this first section, just some practical prayer points that people could take away and pray.
Yeah, we have if you use PrayerMate, the PrayerMate app, or social media, we put out prayer points every day for different specific things. So, look us up. CMF UK, I think, is the PrayerMate app name to follow. But just be thinking about the mental and emotional strain. Just pray for people's heads, that their heads would be clear, that God would guard their emotions as they go in, to prepare them for that. And then I think of it as head and hands. Then what are the tasks they're doing, what their hands doing every day. Just sort of try and put yourself in the mindset, the position of what do you think it might be like as a doctor or a nurse or a midwife or a pharmacist, or anybody going into work. What things might they face? What tasks might they have to do? What might they be anxious about? Just imagine them walking into work, and just pray for their steps through the hospital and some of the tasks they have to do, and pray for opportunities for support for them. If you know a healthcare professional, why not drop them a text or a WhatsApp and just offer to pray, ask if they've got specific needs, but if not, just let them know you're praying for them anyway. That can be such an encouragement. So thanks.
Brilliant. Jenny, that's the end of section 1 just there. For those who are listening, we'll be back shortly. But Jenny, thanks so much so far for what you've shared with us. Welcome back to part 2 of this conversation with Jennie Pollock, who's the Associate Head of Public Policy at the Christian Medical Fellowship, otherwise known as CMF. Now, as a medical organisation, CMF has been asked a lot of questions, I'm sure, about some of the more tricky ethical questions raised by COVID-19. One of these is about the ethics of the vaccine. Controversial and tricky. And this is the opportunity, Jenny, where we're briefly going to put you on the spot. And I've no doubt you're going to answer any and every ethical conundrum that might exist about the COVID vaccine. But perhaps scaling that back slightly, we'll take just some answers to 3 questions. Firstly, Jenny, can you tell us just a little bit more about how exactly the vaccine is made?
In brief, no, that's way beyond my pay grade. I'm not a biochemist by any means. But I think the question you're asking refers to what people might have heard about the link with abortion. So there is a cell line which is developed from tissue taken from a baby who was aborted in 1973. And that line, it's called an immortalized cell line. And basically that just means that whereas usually cells can divide a set number of times and then they're unable to keep multiplying, this cell line is able to continue multiplying and dividing many, many, many times. And it's been used in all kinds of medical research, in development of lots of different medicines, lots of different vaccines that you and I have probably both taken. Many of our listeners, most of our listeners will have taken. So it's been well used over the decades. It's a very common one. One of my housemates is a biochemist, and when I mentioned it, he said, "Oh yes, I've used that. We use that for testing and developing all sorts of medical therapies and vaccines." So the different vaccines have been developed using that in different ways. So the AstraZeneca one developed at Oxford used that in the development of the vaccine. So a way that it makes sense to me is to think of it as kind of a growing medium. So if you were growing cress seeds, you would grow them on a bit of cotton wool. And this cell line is kind of the equivalent of that cotton wool. So people are worried, does this mean that there's, DNA or bits of aborted baby in this vaccine? No, there isn't. Just as there isn't cotton wool in your egg and cress sandwich. It was just the medium that it was grown on. It was a good way of growing and developing that. The Pfizer and Moderna vaccines, they didn't use this cell line in the development phase, but they have been tested on it. So maybe that's like dropping the vaccine onto a bit of cotton wool to make sure it's safe, make sure it doesn't dissolve it instantly or something. So they have been associated with it, but again, at a much later stage. So does that help? Does that answer the question?
Yeah, I think so. I think that one of the things we've noticed is just the amount of speculation about vaccines and how they've been made, what's in them, and so on. So that was a really helpful and clear explanation. And of course, for some Christians, as they contemplate receiving the vaccine, what do you think are some of the things they should be thinking about from a kind of theological Christian perspective to help them reach that point of decision?
Yeah, there's a wide variety of things. I've done a podcast on this with Dr. John Wyatt for the Evangelical Alliance, that's available on the CMF website, that goes into a lot more detail than we've got time for here. But some of the things are questioning whether you're cooperating with or complicit in evil. Obviously, CMF, like CARE, believes that abortion is always wrong, and we do not want to encourage the use of abortion at all. And our understanding is that, sorry, let me say that again. One of the things you want to consider is whether you're cooperating with or complicit in evil. CMF, like CARE, is very much opposed to abortion, and we would want to reduce the number of abortions taking place. We certainly wouldn't want to ever endorse anything that encouraged abortion or required further abortions to happen. The fact that this one happened a very long time ago, that, as I said, this cell line, the cells being used now are, generations descendant from that. There's a lot of distance in intention and in complicity with the evil of abortion in that. So that's something to weigh up. Does this perpetuate evil? Using this vaccine doesn't encourage any other abortions to take place. This one has happened, and sad though that is, it's not perpetuating it. It doesn't require any more abortions. So that's something to weigh up. Is there any other option? If you have a look online, there are websites that tell you exactly where the vaccines came from, how they've been developed, and you can find out whether they've used this cell line, which is called HEK293. That's the one to look out for. And there's another one called PER6. You can see whether those cell lines have been used in the development of the vaccines. And there are some in development that haven't used these at all. So you might want to consider how far away those are. Is it a greater health risk to yourself and others to wait for another one to come? Or is it better to take the one that's available now and protect others, for the greater good? When this first hit the news, it was because some Catholic bishops in Australia had heard about this link, and they wrestled through, and they decided that for them, the greater good was better served by raising awareness of this issue and asking governments to find other ways of developing vaccines and medications, but in this urgent situation, to be accepting the vaccine that was here rather than waiting for one that might not come in time from other sources. God can bring good out of evil. There are many cases in the Bible, Joseph obviously being the classic one of, you intended this for evil, but God has used it for good, that God's been able to redeem. He's a redeeming God. He's been able to redeem terrible evil and use it for his glory and for good. This, you may decide, is one of those situations as well. And also a line that I got from Dr. John Wyatt: are we straining out gnats and swallowing camels? He obviously also got that from the Bible. It's in Matthew 23. And the question there is, are we focusing on this one vaccine, but ignoring the fact that there are 200,000 abortions in the UK every year? And that number is likely to be even higher this year, just because of the extra strain that has been going on. And so, are you worrying about this one tiny historical evil, whilst not ever speaking out about the much bigger ongoing one? And that might be a way of thinking about opportunities to speak into that. If you're looking for a practical response to that, the English and Welsh governments are currently holding consultations on whether to continue the provision for abortion to take place at home, for the abortion pills to be taken in the home. That's something that we would want to oppose, want to to end once the coronavirus ends. So you can look up those, make your response to the consultation, and make your voice heard in that way, which might have a bigger impact overall, and hopefully would have a bigger impact on abortion in general.
It's
a lot to think about there. Sorry.
No, it's great. I mean, it is such a minefield on one level. I know of one former pastor who, when I asked him, he's in his 80s, I said, "Will you take the vaccine?" And without missing a beat, he said, "Absolutely. It's my civic duty to do it," which I thought was a really kind of fascinating, looking at it from the vantage point of the common good, and how can I love my neighbor, and if my neighbor is every other person in the vicinity, one way that I can do that is by protecting myself so that I don't, God willing, transmit the virus, which I guess is another kind of helpful, practical way of possibly approaching this. Jennie, there's so much more, obviously, that we could say both on healthcare professionals, vaccine, and then also home abortions and the risks of carrying that on, and some of the questions around that. We're going to draw this to a close, but I don't want to leave without giving you an opportunity to tell people where can they go if they'd like to find out more about some of the things that you have spoken about on this podcast.
cmf.org.uk. That's our homepage of our website, and there's a big section there on coronavirus resources that'll point you to all sorts of blog posts, to other podcasts, to all kinds of resources that you can use.
Fantastic. And just to add to that, one way that you can also get to the CMF resources is by going to care.org.uk/cause/coronavirus. It's our COVID-19 resource hub. And alongside pointing you towards some of the fantastic work that CMF is doing, you'll also find our special 10 ways to pray about coronavirus, which gives you some inspiration and encouragement for how you can be praying for our nation, for healthcare professionals, and also for bigger international questions around coronavirus as well. Jennie, thank you so much for your time. Thanks for joining us for this recording, and every blessing to you in the work that CMF are doing.
Thank you so much. It's been really great to be here.